Okay, good afternoon, everyone. Thank you for joining us for our free Healthy at Work webinar series. My name is John Beveridge. I'm the coordinator for occupational health and safety at Windsor Regional Hospital and chair of the Working Toward Wellness Committee. Jeff McEwen, manager of recreation services at St. Clair College, will be moderating the webinar today. Just before we begin, some customary housekeeping items with respect to the audio. If you're having any difficulty hearing us, just double check the volume, make sure it's turned up a bit, comfortable level, and we'll go on from there. Questions, if you have any questions, you can post them in the chat, and toward the end of the presentation, we will entertain those to the best of our ability, time permitting. But as in the past, if we do run a little bit short on time, we'll get them answered one way or another. We will also, as per our practice, we'll be recording and providing a link to the recording, so for future viewing. Okay. As well, there'll be a short survey at the end that we'll send out to get some valuable feedback from you. Okay, so now I would like to introduce our guest speaker, Carrie Davis, who is Workplace Outreach Worker for the Canadian Mental Health Association, Windsor Essex County branch. Carrie is a registered social worker with the Ontario College of Social Workers and Social Service Workers with a Master of Social Work from the University of Waterloo. She has worked with the Canadian Mental Health Association Windsor Essex County branch for the past 14 years in various roles, her current role being Workplace Outreach Worker. In that role, she provides mental health education, short-term therapeutic supports, and resources navigation to workplaces throughout Windsor Essex County. We thank you, Carrie, very much for speaking with us today on service navigation, a topic that is always important, but has also been highlighted throughout the pandemic. So just before we pass the mic over to Carrie, we have the land acknowledgement. While it is a well-traveled land, I respectfully acknowledge and express my sincerest gratitude to be able to gather, work, learn, and reside today in the traditional territory of the Three Fires Confederacy of First Nations, comprised of the Ojibwa, the Odawa, and the Potawatomi peoples. I identify as a settler and acknowledge the importance of the treaties and am committed to the calls to action in the Truth and Reconciliation Commission of Canada. Indigenous peoples continue to experience trauma caused by colonial violence. At CMHA, we are committed to advocating for and reconciling with Indigenous communities across Canada. I will now pass the virtual mic over to you, Carrie.
Thanks, John. As John said, I'm here to share some information about optimizing workplace psychological health by understanding resource navigation. And I just want to take a moment to acknowledge how difficult the past few years have been for everybody in the workplace and at home. And as the lines between school, work, and home life blurred, we have seen an increase in mental health symptoms, domestic violence, eating disorders, substance use. We felt a sense of loss and isolation and loneliness. And people are still feeling exhausted, overwhelmed, and unmotivated. But one thing I've learned over the past little while is the importance of connection. So today I'm going to share with you some information around resources for workplace mental health, adult mental health, children and youth resources, eating disorder supports, substance use, and other community resources. And although I've only shared a little bit of the resources in the community, for every resource I located, there were 3 or more. So if you are looking for something that you didn't see, please reach out to to myself or to someone else on the committee, and we will be able to provide you with that information. So we're starting with resources for workplace mental health. And so one of the resources that I like to turn to is the Mental Health Commission Workplace, or the Mental Health Commission. They provide information on workplace resources for psychological health and safety, as well as information for frontline workers, youth, and adults. The workplace strategies for mental health help employers to implement psychological and health and safety in their workplace by developing resources around how to place the information on their agenda, and as well as tools and training that they can use. CMHA Ontario put out a toolkit at the beginning of the pandemic, but they've revised that toolkit to support psychologically safe return to shared workspaces. So as people are beginning to come back into workplace space, many people are starting to feel anxious and about that transition. So this is a toolkit that will help employers and employees navigate that transition. And several of the employers in Windsor Essex County offer an EAP benefit to their staff. So that EAP is an assistance program that offers support for free for professionals, and it's confidential counseling. The service is offered 24 hours a day, 7 days a week to help with a variety of issues. You can consult with your manager or human resource department for more information around that benefit. There's the What's Up app, and this app would need to be set up by your agency. It's a peer support model, and it promotes psychological well-being in an organization. So what happens is if somebody is feeling overwhelmed or a colleague is in distress, they connect on the app and they can get help from their HR team or from a peer that they're working with. It helps to develop coping skills as well. And then there's a mood diary function in it. Pocket Well was developed, an app developed through the Wellness Together Canada, which is a mental health and substance use website funded through the Government of Canada. It links individuals who live in Canada and abroad to resources, tools, and counseling in the form of peer support or for frontline workers, youth, and adults for mental health or substance use. And locally, we have Family Service Windsor Essex. They offer counseling appointments and they offer walk-in counseling, and it's available through connecting over the phone, but their counseling is offered at according to affordability. So there are predetermined fees on a sliding scale, and it can be offered over the phone, face-to-face, or through a virtual platform. Other resources or other services at Family Service Windsor include the Elder Abuse Response Service. So this is an intervention provided to adults 55 years or older if they have experienced even one incidence of abuse that can include financial, property, physical, sexual, mental, or emotional, or it could be caregiver neglect or self-neglect. They also offer adult protective service worker program to support adults with developmental disabilities living in the community, and the Windsor Essex County Housing Connections, which is a partnership between community agencies that are working together to help find people affordable housing. MindShift app was developed by the Mood Disorders Association of British Columbia along with Children's Hospital in British Columbia. It is a CBD-based intervention used to manage moods and alter behaviors. And then there is the Hope app that was developed by the Center for Addiction and Mental Health. It is a free smartphone app, and it's used for individuals who are experiencing crisis or thoughts of suicide to develop a safety plan. So they can use and go over the safety plan with their caregivers or healthcare professionals. Moody App was developed by the Mood Disorders Society of Canada, and it helps track food intake, sleep, physical activity, self-care, and it helps to motivate individuals to activate behaviors as well as change behaviors, and it helps people to notice any patterns that they're having that might be causing a fluctuation in their moods. It's a good companion or complement to other mental health services. The Bounce Back program is run by coaches who are trained in CBT, and that offers support to individuals 15 years and older, either over the phone or through online videos, to help manage moods, mild to moderate depression, and stress, anxiety, or worry. It is also offered in over 100 languages. And then there are virtual therapy options for people who prefer that modality, so they can just go to therapy from their own home. There's the Beacon, which is guided digital therapy, personalized, receive support from a therapist one-on-one, and then there's Ability CBT, which is also internet-based cognitive behavioral program. And so if you're wondering, should I be going to the emergency room to seek supports? This slide kind of tells you when you should go to the emergency room for support. So if you're experiencing, or someone is experiencing suicidal thoughts, self-harming behavior, substance-related intoxication, acute psychosis, urgent medical emergencies or issues that need medical attention, severe alcohol dependency, or any aggressive or violent behaviors that are putting others at risk, then you should go to the emergency room. The Community Crisis Center is the front door service. Phone number is the front door service to mental health. So if you are unsure of where to call, if you're in crisis, you can connect through mental health services through the Community Crisis Center. The phone number is 519-973-4435. They are located at the Crisis and Mental Wellness Center 7 days a week for walk-in from 8 a.m. to 8 p.m. and at the Windsor Regional Hospital OLAT campus in the emergency department 7 days a week as well from 7 a.m. to 11 p.m. Also at the Crisis and Mental Wellness Center is the Mental Health and Addiction Urgent Care Center. And that the Mental Health Addiction Urgent Care Center came about through the pandemic as a way to offer support to individuals aged 16 years and older who are experiencing mental health or addiction crisis. And they're not safe to wait in the community, but they're not quite at the level where they need hospitalization or emergency room support. So this will help decrease the risk of worsening mental health symptoms that and kind of navigate away from the hospital. Their services include psychotherapy or psychosocial support, urgent psychiatric assessment and consultation, medical assessment monitoring, connection to community-based services, and addiction management support. Again, so their hours of operation Monday to Friday, 11 a.m. to 7:30 p.m. And CMHA front door is also located at the Crisis and Mental Wellness Center downtown. CMHA, we provide non-emergency services to individuals with moderate to severe mental illness or addictions that require case management. We also have specialized programs such as the early intervention program for individuals experiencing first episode psychosis that starts at about age 14, and then it goes up just depending on where the need is. And we offer housing supports, justice support, release from custody, bereavement program, grief works for children from preschool up, therapeutic counseling, as well as CMHA Healthcare Center at a different location. And so you'll notice that all these numbers here, we've talked about the resources, and they're all located at the Crisis and Mental Wellness Center, the Mental Health and Addiction Urgent Care, and then the phone number to the Crisis and Mental Wellness Center, CMHA, and the crisis line are all located at that one-stop shop And if you require assistance for children, they are not, here's the phone number, 519-257-KIDS, and that is located at the Connaught Building, 3901 Connaught, Windsor, Ontario, off Prince Road. They provide counseling to children up to age 18 and their families who are in need of mental health support, and it's free. They offer counseling clinics Monday to Thursday, 8 a.m. to 8 p.m., Friday, 8 a.m. to 4:30 p.m. And for the children who prefer support over the phone, or they're looking to connect with somebody, they can do so through the Kids Help phone by texting connect to 686868 or calling 1-800-668-6868, and they can receive text support or phone support and let over to meet them where they are at. And so we're kicking off the Windsor Youth Wellness Hub. It is opening next week. There will be services provided, and it is located, the temporary location is Cottage 6 at Maryville on Wells Street. Our grand opening date will be March 21st. They offer supports for youth aged 12 to 25. The supports were informed by a youth council. It is a walk-in service, no referral necessary, no appointment needed. They're there to provide support for mental health, substance use. They offer primary care, therapy support, peer supports, educational groups, and recreation activities. As well, the other resources offered at Maryville include a day treatment program for individuals 13 to 17 who might be having difficulties in school setting, and they continue to go to school there, but also receive services. They might be experiencing problems with their family or social settings. So this is an alternative program to help those individuals. They also offer acute care mental health programs. So that's acute psychiatric inpatient programming for children or youth 7 to 16 who they service Chatham, Kent, and Windsor Essex at Maryville. These are individuals who are experiencing significant mental health problems. They will help work through, have them there for an inpatient program, and then work with their families to develop plans for discharge and aftercare. There's the Triple P Positive Parenting Program, which is an intervention program, webinar-based series or face-to-face series about teaching parents about how to foster positive relationships with their children. They also offer counseling services to individuals 12 to 20, outpatient-based. There's the Pre-Venture program for youth 12 to 17, aimed at strengthening youth's ability to build the capacity to cope and work towards goals, but reduce their risk for substance abuse or substance use. If you're looking for those services, you can do an intake at the Maryville number, or you can call in for a single session phone counseling for individuals 13 to 17 years old and their families, offered Monday to Friday from 9 a.m. to 5 p.m. Noah's House offers mental health support through social workers every other Wednesday, as well as counseling support on Mondays and Fridays. There's no wait list. In order to get mental health support through Noah's House, you would need to log on to their web link and schedule an appointment that way. Noah's House also offers drop-in recreational programs, and they have a calendar up to date each month. A few more youth services. So if your youth is in crisis, or you're a youth in crisis and you're 15 years of age or under, please go to the Windsor Regional Hospital Metropolitan Campus ER on Leeds Avenue. And then if you are a youth or you know a youth experiencing crisis, they can attend the Windsor Regional Hospital OLET campus. And if individuals up to 18 in Leamington would go to Erie Shores Healthcare on Talbot A few additional resources or phone lines for youth would be the Indigenous Youth phone number. It's available 24 hours a day, 7 days a week. The Black Youth Helpline, it operates from 9 a.m. to 10 p.m. LGBT Youth Line is Sunday to Friday, 4 p.m. to 9:30 p.m. And Trans Lifeline is available 24 hours a day, 7 days a week. This resource here, Kundal Center, is for service or for primary care providers and clinicians that help youth who are experiencing depression. So this web link offers information, it offers assessment tools as well as guidance for clinicians to provide medication to youth, what types of antidepressants to use first, and what dosages and what to move on to next if one medication is not working. It also provides resources for healthcare providers on interventions that they can use. And the Teen Health Center offers services to youth 12 to 24, and they provide medical care groups, counseling, eating disorder support, and addiction, as well as an e-library. There are wait times for the counseling and eating disorder support. So you can see right here, there are just two different numbers. So that they have in the red, there's the Teen Health Center number to connect to Teen Health Center directly. But if you're trying to reach eating disorder support, you would connect the 1-855-969-5530 to reach a centralized access. And this centralized access will help to, they'll do a pre-screening and determine whether the health center, Teen Health Center or BANA would be most appropriate. During the pandemic, we've seen a significant increase in eating disorders. So the wait time for BANA services is about 10 to 12 months. If you require support immediately, connect with that phone number, but also follow up with your primary care provider. And there's online supports for individuals, their family members, and professionals to help assist persons who are experiencing eating disorders in the community. And for some more information, you can go to the CanPED website for support to care for youth who are experiencing eating disorders. They offer modules and useful links about information. And so now we're going to move into addiction supports. The hand-in-hand support is a sober living home for individuals who are experiencing addictions. They are provided support at pre-entry all the way to maintenance and relapse prevention. So they help individuals to also, so they can live there in the sober living home, but after help them to acquire housing to move out into the community. They also do food donation and homeless outreach. You can connect to them on their website and fill out an intake form or call the number provided on the screen. The Brentwood Recovery Home offers a number of supports for adults, short-term and long-term residential treatment, follow-up aftercare, and relapse care. They also offer adolescents age 13 to 15 day treatment programs, as well as 16 years and older, a safe haven, social skills. They focus on education. So throughout their day treatment program and residential program, they help the youth to connect to their school and continue doing schooling. They offer family support to children, couples, women, and parents who are experiencing family members with substance use issues, as well as counseling service and health services. And the House of Sofferstein has two locations as well. They have the ad stall and they have the residential program on Chappelle. So they have tailored their programs throughout the pandemic to provide virtual therapy online. And so they offer a number of therapeutic programs for women, for men, for mothers, for fathers in recovery. They offer family supports as well, and they have a residential program for intensive substance misuse and trauma. Caring Connections, that's for moms at any stage of their pregnancy, and they offer supportive housing and transitional housing. Windsor Life is a faith-based treatment center for adult women and offers long-term residential program for 12 months, and then aftercare programming to reintegrate back into the community. Break Free is an online tool. It also has a companion app. I found it difficult to use the app, but if you're signing on through their website, they'll ask you to create your free account. So you'll add your email information, your password, and you'll need this code in green here on the left of the bottom screen. It's for the service code is CMHA Windsor Essex 21 to be able to use the service. The criteria is that individuals must be 16 years of older, motivated to change, and have experienced substance use issues in the past 3 months. Positive Pathways provide services to individuals who are at risk of or have been diagnosed with HIV, at risk of hepatitis or any blood-borne sexually transmitted or diseases or infections. They provide support services around case management, practical supports, food and nutrition, education and outreach, and they offer harm reduction services. So they offer the needle exchange, but they also offer a number of other resources. Trans Wellness Ontario offers educational seminars to allies directed at organizations or community members. They also offer community workshops for individuals who identify as trans. They are delivered by trans educators and mentors and other programs, educational services, as well as individual advocacy, housing services, counseling, faith and family supports, and ID clinics to help individuals change their gender on the ID. Hiatus House is a 24-hour emergency shelter and helpline to help support individuals in domestic violence situations. They offer beds available. There's 42 beds for women and their families, housing supports, counseling, income supports, children's services, legal services, education for upgrading and job training, as well as health and well-being support. They offer Fresh Start programs for women and men, for men who are abusers. And then they offer school-based supports for children in school who have witnessed abuse, as well as for moms and children under the age of 4, and then other training, special programs such as they offer human trafficking. They're in partnership with human trafficking projects, and they offer up to 75 languages. And the UHC Unemployment Health Center offers emotional support for newcomers to maintain positive mental health and well-being. So there's opportunities to provide short-term counseling to permanent residents and conventional refugees age 18 plus, so they can help provide support around relationships, family problems, anxiety, depression, homesickness, trauma, discrimination, domestic violence, and culture shock. The Southwest Ontario Aboriginal Centre has multiple locations throughout Southwest Ontario, but this information I'm providing the one in Windsor, Ontario. If you are looking for a centre outside of Windsor, you can go to their website and link up with resources where you're at. Also, there is, they provide a wide range of wellness services to First Nation, Inuit, and Métis individuals in traditional healing, mental health and addiction services, clinical services. They offer primary care, diabetes support, education, nutrition, Aboriginal midwifery, palliative care, child and youth services, dental, FAS support, and senior supports. To be eligible, you must provide proof of lineage. And some updates from the health unit. So the health unit is, or the WeVac site is no longer providing availability on their website to book appointments or call in to book appointments at the mass vaccination sites. In order to get your vaccination, you would just show up, and that there it has the walk-in hours for the COVID vaccines on the slide. You can also connect with participating pharmacies or your primary care and look at the WeVac site for any pop-up clinics that are happening in the community. And another update from the Windsor Essex County Health Unit is that they're doing catch-up immunization clinics for students in 7th to 12th grade. So during the pandemic, the health unit's focus pivoted. So now they're going back to try to connect with these individuals. Letters will be sent out to eligible individuals, and they'll be hosting school of vaccinations for the month of March. Clinics will be offered at the mass vaccination site at Devonshire. As well, you can reach out to your primary health kit provider to get information if they will do the vaccinations for your students, or you can log on to the Windsor Essex County Health Unit site and or call to find out more information about where you might access these vaccines if you do not have a primary health provider. And just some other resources, the Credit Canada Debt Solution helps individuals with financial counseling and education services, including free consultations about budgeting and debt management. It's offered over the phone, so you can connect through the 1-800 number. Connects Ontario provides more information if there's something else that you're looking for substance use or mental health. You can connect to their 1-866-532600 number. You can also connect to them if you're looking for primary care support. And Life After 50 is a senior, I believe it's 50 years and older, supports for individuals. It's membership based to enrich the lives of older adults by providing opportunities for socialization, wellness, fit. They offer foods, all different types of support. So if you're interested, please connect at www.lifeafter50. And so just again, my name's Carrie Davis. I'm the workplace outreach worker at the Canadian Mental Health Association, Windsor Essex County branch. If you are looking for any more information about service navigation or you would like to connect with me, please feel free to give me a call at my phone number or at my email address. And that's it. Thank you.
Great. Thank you very much, Carrie. Plenty of information and resources there. I'm going to turn things over to Jeff now to just review the chats and if there are any additional questions for Carrie.
Excellent presentation, Carrie. Thanks so much. I know that's a lot of information to put into a 40-minute slideshow. So we did have a couple questions. The first one was if the presentation will be listed afterwards. So I did provide that in the chat. We will be posting on the Working Towards Wellness website later on today once the presentation is edited. The first question for you, Carrie, is, are you aware of what the wait times are for non-urgent counseling and support?
So it would just depend on what services you're looking for. If you're looking, it's different at different organizations. So Right now, I don't think we have a very big wait time at CMHA. I guess other people in the group can speak to their organizations. I know that the Teen Health Center has a wait for their counseling services. At Noah's House, there is no wait right now. Beth, do you know about?
At Family Services Windsor Essex, thank you, Carrie. People can use our walk-in counseling clinic, which is happening telephonically still, Tuesdays 12 to 8 and Fridays 9 to 5 for walk-in clinic telephonic counseling. And our regularly booked counseling appointments, we're booking 2 weeks out. Thank you.
Great. And we had one other additional question. If you can comment on with Regional Children's Aid Center or the Be Safe app. I believe Tammy is on with her camera right now. She was the one that posted that. If she wants to elaborate.
I was just letting folks know that the Regional Children's Center does also have a drop-in clinic. And so youth 0 to 18 or 17, sorry, can come in for a single session, but primarily our agency services youth 6 to 12, but a youth under 17 can come in for a single service. And we're open 8 to 8. Monday through Thursday and 8 to 4:30. And then I also wanted to let folks know about the Be Safe app. That's an app that we have available for community information on our local resources that anyone can download. And it also has safety plans and other things available for young people who might be experience some, suicidal thoughts and things like that. So that's a wonderful resource as well. And it's just called Be Safe, and it's from the Mind Your Mind website if you're looking it up online. And RCC is the Regional Children's Center. We have lots of youth mental health services and developmental delay services for primarily, like I said, youth 6 to 12 years old.
Excellent. Great. Thank
Sorry,
you.
one more thing. I'm also the coordinator for the Triple P program, the Positive Parenting program, and we offer all kinds of parenting classes in the community. Some for parents with children 0 to 12, some for parents with children 11 to 16. And recently we started offering a program called Fearless, and it's for parents from with their children ages 4 to 14 whose children have mild to moderate anxiety. All of those can be accessed on the Regional Children's website or www.windsor-essex.ca.
Excellent. Thanks for those additions, Tammy. Much appreciated. I believe that was all the questions we had in the chat so far, Carrie.
Well, thank you for that additional input, everybody.
Well, thank you again, Carrie. Very timely presentation. I'm sure most of you that are listening and viewing are thinking the same thing. As a community, we've been living differently for so long, just trying to adjust to a new normal or trying to imagine what that new normal is going to be like. We get through to the other side, so to speak. But many of us, in our workplaces, we're continuing to adapt. Whether we have been on site the whole way through the pandemic, some of us have, others have not, have been away for the most part, returning, to some form of in-person, in-office, on-site work, some kind of a hybrid model, a little bit of both, or some continuing to work from home. So we know that regardless of your situation, this pandemic has taken a toll. So we're hoping that you found these resources helpful. As Jeff and Carrie have both alluded to, there's 3 more for everyone we've talked about. There's so many resources, but it's great to at least have something somewhat consolidated and available to us. regardless of what your needs are at this point in time. So thank you very much, everyone, for joining us. And yes, we will post this on our website. And if anyone has further interest in our committee and what we do, then please feel free to visit our, I'll say, new website, refreshed website, and can reach out and contact us that way. Okay. All right. So thank you very much. Have a great day.